Hi, my name is John Howard and Merry Christmas. Today I'd like to give you the best protocol I know of to treat headaches. It doesn't matter what kind of headache your patient has. It can be a migraine, a menstrual headache, a liver-yang rising headache, or a spleen qi deficiency headache. It doesn't matter. When this protocol works, it works about 90% of the times. You're going to love it. It's probably going to be the best protocol that you have for treating headaches, and it's really that quick. I'm going to tell you two quick stories about it. One happened a long time ago, and the other one just happened yesterday, my last patient of the day. One of the first times I started using this protocol, I went to a patient's house a number of years ago when I was working out of my home. I used to do traveling. And when I went there, she explained to me that her headaches used to be a 10 out of 10, and then after seeing the famous Dr. Lee from Shanghai, it brought her headaches down to about a 6 out of 10. And then I went there and I did the protocol, which I'm going to show you. I took a history. After about 15 minutes of taking the history, I looked at her and I said, well, can you tell me how your headache is? And when we put them in that morning, the needles, she said, my headache's about an 8. And when I asked her that question 15 minutes later, her headache was completely gone. I thought that was a good thing, but she told me to take the needles out, and she started talking like I was demonic, and this is crazy, and the famous Dr. Lee couldn't get my headache down this far, and it turned out to be really ugly. I actually had to leave the house right away and took the needles and get payment and ran out the door. About 2 weeks after that, her husband called me up and asked if I can come back and treat her. And I said, no way. I don't think I ever heard from her again, but it's kind of funny because about 6 months after that second time, I got somebody else asking about headache treatments at their house in Bethesda. So it might have been her. Yesterday, I was treating my patient, and it was the last patient of the day. And I was treating her for shoulder pain and some other type of other pains. And I came in today, she came in and I said, so today, what is the worst of your pains? And she said, actually it's my headache. I said, oh, you have a headache? She goes, yeah. She goes, I woke up with a really bad migraine. And I said, okay, let's get rid of your headache first, and we're gonna treat your, whatever your other common complaint is. And she goes, well, that's really the only complaint I have today. So I went ahead and I did the one needle technique, which I will show you in a second. And I turned around, I just wrote, 50-something-year-old white female with chief complaint of the following symptoms. And I wrote down 4 or 5 of her symptoms. I put my pen down, I looked up, and I said, well, how's your headache? And she goes, it's gone. It's completely gone. And that's what you're going to get when you see this protocol. It's going to work that quick, 90% of the times. Okay, so without further ado, let me show you how to do this protocol. There's really 3 steps to the protocol. I'm going to show you 2 today. The third step's a little more advanced, a little more, it takes a little more time to explain. And we do teach that in the Battlefield Acupuncture course. To be exact, it's the Advanced Battlefield Acupuncture course. But the protocol you're going to learn today is going to be just as well. It's going to help you, and hopefully you can use this starting as soon as possible. So let me tell you about the 3 points you're going to be using. The 3 points you're going to be using are point 0, Shinmin, and omega 2. Now when I say these points, you probably don't realize that some of these points are not exactly where they are, because this is one of Dr. Niemsal's protocols. So I'm going to show you exactly where he says these points are according to Niemsal. Okay? So let's get started here. So I'm going to pull my little head over here. Let's see if my wife can zoom in on this. Oh, sorry. So the first point is point 0, which is not up here, it's almost where Chinese stomach is. The second point here is Shinmin. And the Shinmin point he uses is right where the triangle fossa kind of meets. And the third point is omega 2. Okay? Now for the first protocol, you're going to see the patient can come in. Okay. The patient can come in, and if you have some time on your hands, you can say, okay, well, let's talk about getting rid of your headache. They might say, well, my headache's really not that bad. It's a little bit of a nuisance. And you can say, okay, let's put the needles in and take the history. And then when you're done taking the history, ask them about their headache. And then the second way is to do the one needle technique, which I was just talking about the last time I used, which was yesterday. So here's what the needles look like when they're in. I use these nice bright orange needles. These are not the needles we use. We use the 1-inch purple Sarin L gauge needles. I'm not sure if they are 34 gauge or 36 gauge. I'm not quite sure off the top of my head. I just know the purple. But as long as you use the L gauge, I don't really think that matters. So your patient's going to come in, and what I usually start with is I start with the bottom point, which is the, you might know it as stomach, or as I said, Dr. Niemzel calls it the point zero. Then I move up to the shin min, which is right, I kind of try to draw it out for you, right in the crease of the triangle fossa there. And the final point is the omega-2 point, which is right here, which is basically right above the crease where the triangle fossa is. Right there. Okay. So you put them in that way. I usually put them in from the bottom up because it's a little more easier to do it that way. You can do it any way you want. And then what I do is I just go to the other side and I put the needles in, and then I'll have the patient just sit there on the table or lie there on the table, and I'll start taking history. And about 10-15 minutes, how long it takes you to take a history, I'll say, well, how is your headache? And usually about 90% of the times, if not more, they'll say, it's completely gone. Wow, this is great. This is terrific. And then you go from there. And then after that, the third technique, which I told you we teach in the class, it goes on further where we tell you how to keep the headache away probably for a week at a time. We're having a class actually second week of February here in Gaithersburg, Maryland, so if you're interested, you can contact us through our clinic. Okay, so you have the first technique here is where you put both needles on both sides. You have them sit there or lay there while you're taking their history. And after 20 minutes, you ask them how it is. Great. Now, the second technique I'm going to show you is if they come in and they have a headache, or you're running behind on schedule and you just want to get rid of the headache real quick. I'm going to leave these needles in just to show you where the third needle goes. It's in the scalp, and it's referred to as the magic scalp point, or as we know it to be, it's called the end point for Dr. Niemzel. So the one point in the scalp is right here. And the reason why I'm leaving these needles in is you're going to use this omega-2 needle as a guide. So if you would see that, if you would imagine that needle there before you even started the protocol, you would take your one needle and you'd place it just like that, kind of like make a cross. See how close I am? So where the needle is in the scalp, but it's actually hanging right on the ear, just right above the ear, just kind of graze the ear as you're going over it, and will probably lay flat on the ear. And you push the needle and you advance until it stops. And like I said, the omega-2 is just here for reference. Okay? Just like that. And what I usually do is I'll ask the patient what side their headache is on. And if it's on the left side, I'll do it on the left side. If it's on the right side, I'll do it on the right side. With this technique, if they say it's on the left side, I'll put it here, wait about a minute, ask them if it's gone, and they'll say yes or no, usually yes. But if it's not, what I will do is I'll take another needle and go to the other side and do that same point on the other side. And that right there will usually knock it out. The other thing you can do is if you do all three needles and after 10 or 15 minutes, the patient says that no, it's still there, then you can take the magic scalp point or the end point and apply it like so on one side or both sides. But this will really get rid of a lot of patients' headaches. I mean, you'll be really amazed at how well this protocol will work. This is probably one of my best protocols. When somebody comes in with a headache, I'm like, I actually look at my watch, like how long it's going to take. It's almost like a Chris Angel magic trick. It's like that quick, and as you're writing, you're kind of writing slow, and you're kind of looking up at them because you kind of see if they have an expression in their face. But once you're done, you look up and you say, well, tell me about your headache. And you can kind of smile at them because they're going to look around and they're going to be like, it's gone. It's completely gone. So that's my Christmas present to everybody today, and I wish you all a Merry Christmas, a Happy New Year, and a great next year. And I hope this protocol works for you. If you know anybody out there who's an acupuncturist, you may forward on this email to them. Tell them about this. If you guys like this, one of the things with Google is write a response to the YouTube clip. That way it will be ranked up higher, and more people can see this video, and more people will have access to helping their patients get rid of headaches. And it's all about making people feel better and get better. So, to the next time, I'd like to thank you, and I hope this helped. Have a good day.